Okay, let's go.
Be honest, when I say the words electroconvulsive therapy, what's the first image that pops into your head? For a lot of us, it's something straight out of a horror movie. But what if that image, the one we all know, is completely, totally wrong? Today, we're going to tear down that Hollywood myth and look at the modern medical reality of ECT. So, here's how we're going to break this down. First, we'll tackle that cinematic image that's kind of defined ECT for decades. Then we'll pivot to what it actually is today. We're going to dive into who it's for, what the procedure is really like, weigh the risks against the incredible rewards, and finally, rethink its place in modern medicine. All right, first up, let's confront that powerful and, let's face it, pretty terrifying image of ECT that's been burned into our collective memory. And yeah, you can pretty much think movies like One Flew Over the Cuckoo's Nest for this perception. It's an image that has created this deep, deep stigma. But it's an exaggeration, and it's unfortunately overshadowed what can be an incredibly effective and often a truly life-saving procedure. Now look, we have to be fair. The early history of ECT, it was definitely problematic. I mean, this was back before we had modern antidepressants and antipsychotics. So yeah, it was used a lot, sometimes on anyone and everyone, and that led to some very real concerns and complications. But that was then. Okay, so let's flip the script and talk about the modern reality, because today's ECT is a completely different world from its past, and I'm willing to bet it's not at all what you're picturing. Today, ECT is a highly controlled medical procedure, and I really want you to focus on a couple of key phrases here: general anesthesia and controlled seizure. This is a precise medical intervention. It is not a punishment. This slide really just lays it all out, the stark difference. Back then, patients were awake. Can you imagine? Today, you're completely asleep under general anesthesia. Muscle relaxants are used, so there are no strong convulsions. It's gone from being used indiscriminately to having very specific, targeted indications. And because of all that, serious side effects are now extremely rare. So, who exactly is a candidate for this modern, highly controlled procedure? Is it really only for people who've tried everything else and have nowhere left to turn? Well, the thing is, ECT is targeted for some of the most severe and difficult to treat psychiatric conditions out there, situations where a rapid and effective treatment can literally be the difference between life and death. And this is where it gets really interesting, because look at the range of conditions here. It's not just for severe depression. It's an incredibly powerful tool for things like catatonia, where a person can become totally unresponsive, or for severe mania and psychosis that just aren't getting better with medication. You know, we always hear ECT called a treatment of last resort, right? But the clinical reality is, well, it's a bit more nuanced than that. In fact, for certain acute, high-risk situations, the official clinical guidelines actually recommend ECT as the initial treatment of choice. The first thing you try. I mean, just think about it for a second. If you have a patient with acute, severe suicidal thoughts, or someone whose physical health is crashing because of their mental illness, you might not have time to wait weeks or months for medications to kick in. In those cases, the fast action and high success rate of ECT make it the best first-line defense. All right, so what does a modern ECT session actually look like? Let's pull back the curtain and walk through it, step by step, to really demystify this thing. So as you can see, this is a full medical team at work. The patient is put to sleep, their muscles are relaxed, and their vital signs, their brain activity, everything is monitored the entire time. The seizure itself, it only lasts about 30 seconds, and the patient wakes up just a few minutes later with no memory of the actual event. Okay, so let's get real for a minute. No medical procedure is totally without risks. So we need to take an honest, data-driven look at the incredible efficacy of ECT versus its potential side effects. Let's start with the rewards, because the numbers here are just staggering. For patients with depression who haven't tried other treatments, the response rates can be as high as 90%. And even in the most treatment-resistant cases, the ones where nothing else has worked, response rates are still around 50%. That's remarkable. All right, now for the big one, the one everybody asks about, memory loss. And yes, it is a real side effect. It typically affects the period of time right around the treatment itself. So you might have some trouble remembering new things or recalling events from the specific days you had the procedure. But here's the crucial part. The risk isn't the same for everyone, and even more importantly, doctors have ways to actively manage and reduce it. For example, using what's called right unilateral placement, where the current is focused on just one side of the brain, has been shown to significantly cut down on cognitive side effects compared to older methods. And to really put the overall safety in perspective, get this. The mortality rate from ECT is less than 1 in 98,000 treatments. That's about the same level of risk as the general anesthesia you'd get for any minor surgery. Though, okay, when you take everything we've talked about, the high success rates, the modern safety protocols, the very specific people it helps, where does that leave ECT in the grand scheme of modern psychiatric treatments? So check this out. These are the official Canadian guidelines for treating major depression. And what you're seeing here is that ECT has a level 1 evidence rating. That's the highest possible stamp of approval from the scientific community. It gets level 1 for both getting someone well and for keeping them well. It is one of the most proven treatments we have, period. And that really brings us to the heart of the problem, doesn't it? There is this massive, massive gap between the science and the public's perception. We have a safe, a rapid, and an unbelievably effective treatment that is often completely overlooked or avoided, all because of a stigma that's rooted in a past that is long, long gone. And that's the thought I really want to leave you with. Because reconsidering ECT isn't just about this one procedure. It's about our willingness as a society to look past old fears, to embrace the scientific evidence, and to make sure that people who are suffering from the most severe forms of mental illness have access to every single tool that can help them get better.